Good morning. Welcome to DRSC University, Medicaid Waivers and Waiver Case Management. Our presenters today are Anna Maria Connor and Margie Moore Williamson. I will let them introduce themselves in just a minute. Let me go over a few things with you today before we get started. First, this webinar is being recorded and will be available at a later time on YouTube. We will try to save a few minutes for questions and answers at the end of the session. We do ask that you do not share any personal identifying information during this time. And if you have a question come up during the presentation, you can just put it in the chat box and we can get to it at the end. Everyone has been muted, so when we get to Q&A, you will need to either use the chat box or raise your hand. And this is the last session for 2024, so stay tuned towards the end of the year and we will announce what sessions we will be having in 2025. And that is everything I have at this time, so I'm going to hand it over to Anna Maria. Thank you so much.
Good afternoon. This is Anna Maria Connor. I'm a senior attorney with Disability Rights South Carolina. And Margie, would you introduce yourself?
Yes, thanks, Anna Maria. This is Margie Moore Williamson. I'm the executive director of the ARCA South Carolina, and I'm also the proud parent of a 22-year-old son with autism.
Okay, today we're going to talk about Medicaid waivers and waiver case management. I am going to handle the Medicaid waivers, and Margie will step in and talk about case management. So hopefully we won't go too fast. I'm going to go through a few preliminary things about who we are and Medicaid, and then we'll get into the meat of it. Next slide. Next slide, please. Okay, Disability Rights is a private nonprofit. We protect the legal, civil, and human rights of people with disabilities. Our main purpose is to try to help people advocate for themselves so that they can maintain their independence and also they can get the services that they need. We also educate and train individuals, clients, the public, stakeholders, and others, particularly policymakers, about the laws and the rights of people with disabilities. And we promote policies and services advancing those rights and interests. Next slide. We are independent of all state agencies. We are the protection and advocacy system for the state of South Carolina, and all of our services are free. Okay, so let's talk about Medicaid. It's a jointly funded program by the states and the federal government. The states have to actually develop a Medicaid plan set within the rules of and laws of Medicaid. And then they have to allocate state dollars and actually spend state dollars before the federal funds come in and attach. And one of the requirements about Medicaid is that there be one particular agency in the state that becomes the Medicaid agency, and that agency in South Carolina is Department of Health and Human Services. And so HHS, as we call it, or DHHS, is the Medicaid agency for South Carolina, and its main responsibility is to make sure that the Medicaid program operates according to federal law. And one of the rules of Medicaid is that Medicaid is the payer of last resort. So if you have private insurance, if you have Medicare, all of those funds will pay first, and then Medicaid will pay whatever's left over. Another very important thing about Medicaid is that it provides very strong due process rights. So if your services are changed, if you are denied a service, or if any other adverse consequence happens to you that affects your Medicaid services or eligibility for Medicaid, you may have a right to appeal that and the right to go to what we call a fair hearing. Next slide. The state plan is the document. It's really an insurance document, but it is, again, a plan that is developed within the rules of Medicaid. It outlines each state's Medicaid program, and that's an important thing to remember if you ever have to consider moving out of state, or you know somebody that's coming into South Carolina. Each state has its own Medicaid plan that it develops with the federal government. So while some of the bits and pieces of plans are similar, and the rules are from the feds are the same. The state plan of each particular jurisdiction is different. And the first thing the state has to do is choose optional benefits. There's a whole list of mandatory benefits that every state has to have, but then every state has the right to choose from a list of optional benefits. And in South Carolina, our program is called Healthy Connections. Next slide. One of the big requirements of Medicaid is that in order to get a service, once you're on Medicaid, you have to show a medical necessity for that service. For instance, if you wanted to get nursing services, then you would actually have to have a recommendation from a medical professional that you needed skilled nursing services. You have a medical need for that type of service or treatment, and then that might allow you to partake in that service. It's usually documented by medical professionals. It can be a therapist, an occupational therapist, or something like that. And it does sometimes require what is called prior authorization. So sometimes what you have to do is actually go and apply to the Medicaid agency first for a particular service or a piece of equipment and get prior approval before you can engage in that service or get that equipment. Next slide. Let's talk about Medicaid waivers. Next slide. Medicaid waivers are a very important part of Medicaid. Before 1981, Medicaid only paid for services for people in institutional care. In other words, people who needed long-term care. And at that time, all of the care was provided in a facility, such as a nursing home or an intermediate care facility for people with intellectual or related disabilities. But after 1981, when the law was amended, it was actually changed so that states could again offer services and programming out in the community. So they were looking at delivering long-term care services in a person's home or another community setting. These programs are known as home and community-based services waivers or Medicaid waivers, HCBS waivers. You hear all of those terms. They're basically the same thing. But they aim to provide more flexible and community-oriented care alternatives for those eligible for Medicaid. Next slide. The reason why they are called waivers is because states who want to operate a waiver actually have to go to the Centers for Medicare and Medicaid Services, which is the federal agency that oversees Medicaid, and ask for a waiver of certain Medicaid requirements so that they can provide community services to special or a limited group of people instead of providing those services in an institution. Next slide. South Carolina has 8 HCBS waiver programs, and DHHS, again, the Medicaid agency for our state, directly manages 4 of these waivers through the Community Long-Term Care Division. Next slide. DHHS allows other state agencies to manage the daily operation of some of the other waivers, but it does supervise how those waivers are managed. Remember, as the Medicaid agency for South Carolina, DHHS is always responsible for how services are provided and how the program operates. Next slide. All right, the waivers that DHHS operates are the Community Choices Waiver, what used to be called the Elderly and Disabled Waiver. Then there's an HIV/AIDS waiver, the Mechanical Ventilator Dependent Waiver, the Medically Complex Children's Waiver. Next slide. The Department of Disabilities and Special Needs operates the Intellectual Disability or Related Disability Waiver, what we call the IDRD waiver, the Community Supports Waiver, which also serves people with IDRD, the Head and Spinal Cord Injury Waiver, and then the last waiver is actually operated by the Department of Children's Advocacy. Next slide. And it is called the Palmetto Coordinated System of Care Waiver. Next slide. In order to qualify for HCBS waivers, you actually have to meet the eligibility requirements for each waiver. You have to have the disability diagnosis that the waiver requires. For instance, if you wanted to be on the IDRD waiver, then you would actually have to show that you had an intellectual or related disability first. Then the second step is that you have to have Medicaid. You have to live at home or in the community, or you have to want to live at home or in the community. So there are some people that are trying to get out of institutions that can apply for and become eligible for waivers. They do not typically get waiver services until they are out in the community. But you do have to choose between living in an institution and getting services there, or living in the community and getting waiver services in the community. Each of our waivers requires a high level of care, for instance, nursing home, or the level of care that would require you to live in an intermediate care facilities or another institution. You also have to have needs that are addressed by the waiver services. So in other words, you would have to, again, want to look at what is your disability? Does it fit within the definition of the waiver? And do you have needs, service needs and so forth, that again are targeted to be served by that waiver? And you have to receive a waiver slot. In other words, they have to determine that you're eligible, and then they have to award you a waiver slot. Next slide. To apply for an HCBS waiver, you want to contact your case manager or early interventionist and tell them you would like to apply for the waiver. If you're not receiving either one of these services, you may contact the state agency that operates that waiver. For instance, again, if you wanted to apply for the IDRD waiver and you didn't have a case manager or an early interventionist, you would contact DDSN and go through that application process. Next slide. Currently, there are very long waiting lists for HCBS waivers in South Carolina. So the sooner that you look into the waivers, you decide if you need one or that you want to apply for one, and try to determine the best one for you, put in an application. It's very important you do that as soon as possible. Next slide. In South Carolina, on the DDSN operated waivers alone, there are over 19,000 people on the waiting list for those waivers. The head and spinal cord injury waiver has a waiting list of 335. The IDRD waiver has a waiting list of over 19,000. The community supports waiver has a waiting list of over 15,000. And again, it can take a long time to actually move up the waiting list because there are limited enrollment slots or funding availability. So when the demand for slots exceeds that capacity, that's when people begin going on to waiting lists. And as you can see, all of the waiting lists in South Carolina are fairly extensive. The waiting list cannot be addressed until we have additional funds. If you remembered early on, I talked about the fact that we had to actually use state dollars first. So in this instance, to eliminate a waiting list, the state legislature would have to go in and allocate funds targeted at some of these waiting lists, and give the state funds to the state agency that operates the waivers in order to create new slots for the waiver. And only after that would the agency then be able to draw down any federal funds and increase the number of slots under each waiver. Next slide. Once you receive an HCBS waiver slot, you must use a certain amount of those services on a regular basis to keep your waiver services. Each waiver does tell you how many services that you have to keep. Generally, it's 1 to 2 services every 30 days. You actually must receive services, usually case management and another one. But it is usually at least 1 to 2 services every 30 days. If you don't, then you can lose your waiver slot, and you may have to actually reapply. Next slide. To apply for the DHHS operated waivers, you can call the Community Long-Term Care Office or submit an online referral at the 2 links below. Next slide. For the waivers operated by DDSN, you can call their toll-free number, or you can go to their website and fill out an application there. Next slide. For the waiver operated by Department of Children's Advocacy, you contact the Continuum of Care, which is a division of Children's Advocacy in the region where you live. You can find that list of regional offices at the link that we've provided here. Next slide. Now, one important thing to consider is a part of Medicaid called Early Periodic Screening, Diagnosis, and Treatment. And this is something that is for eligible children. Medicaid eligible children, which is defined as people under the age of 21, can qualify for EPSDT services. And what it is, it's focusing on early detection and treatment of health issues. The goal of EPSDT is to ensure children receive the health care they need to promote healthy development and address any health issues early on. And basically, we call this being outside of the waivers is because the way EPSDT operates, if a child who's Medicaid eligible goes and gets a screening and a treating professional diagnoses a condition and then makes a recommendation for services or treatment that would address that condition, then Medicaid is supposed to make sure that child gets it. There are very little restrictions on EPSDT services. That's why we say that children really should be able to get services without having to go onto a waiver. There are situations, though, where some services are provided through a waiver where they are not actually allowable under EPSDT. So it's important to explore both options. And again, this particular part of Medicaid is good until the person reaches the age of 21. So if you have a family member or you yourself are approaching the age of 21, you need to talk with your case manager to determine whether or not you may lose services once you turn 21. And if you're in danger of losing certain services, then you want to look at whether or not you have applied for and been given a waiver slot. Because again, some services may only be available under a waiver. If so, you need to go ahead and get that application in so that hopefully you can transition over to receiving waiver services so you won't lose any services that you're getting before the age of 21. For more information on EPSDT, we actually had a prior DRSC University training on Medicaid and EPSDT, and the link here is in this slide. Next slide. Okay, Margie, I'm going to ask you to step in and talk about waiver case management.
All right, thanks again for having me today. I appreciate the opportunity to participate in this DRSC University. Next slide, please. So what is a waiver case manager? Waiver case managers play a crucial role for people with lifelong disabilities, and they assist their clients with accessing all of the waiver services that they are assessed for. We also assist with services that are funded through state plan or EPSDT and other resources that are out in the community. Next slide, please. So what are waiver case managers responsible for? We provide care planning, which is preparing for your annual assessment. We conduct all assessments and service plans that need to be tailored to client-specific needs. We continue evaluating, reevaluating for additional services to prevent institutional placement. And then we also conduct the level of care, which determines whether you are eligible for the waiver or not. The last thing that we really try to do is provide ongoing monitoring so that we can ensure that all the services that we are authorizing for the client are tailored to their needs. Next slide, please. So what are requirements? Case managers have minimum requirements based on each waiver. So with the DDSN operated waivers, we are required to communicate with you one time monthly. We are required to see you 4 times a year. And 2 of those times that we see you per year have to be face-to-face in the home. Next slide, please. So all waiver services are really tailored to the individual's needs. I know sometimes families can communicate with each other and say, well, this service is out there for your child. It has to be assessed to be a determined need. The frequency and the type of each service has to be justified in our assessments. We have to ensure that the services are appropriate and that the client is getting specific services to meet their needs. The process to do this is to create a catered and personalized plan of care that really meets the needs and requirements and goals for that individual, all the while adhering to guidelines in the waiver program. Next slide, please. Monitoring individuals with disabilities is an essential component of case management and waiver programs because the idea is to ensure that services are effectively supporting every need. We want to make sure that we have regular communication with our individuals or the representative that they have, and then the service providers and any other relevant entities to ensure that all of the needs are being met for the person. Next slide. So we want to always ensure that the health and safety of the person is our top priority. We want to implement the service plan to ensure that that is followed as intended. We want to address all of their needs to confirm that individuals, the services that they receive are sufficient enough to ensure out-of-home placement. We have to ensure that the providers are compliant as well with all of the requirements that they have and maintain expected quality standards. And then most importantly, make sure that the clients are satisfied with all of the chosen providers and the services that they are currently receiving. Next slide. So monitoring goals can include ensuring the client's receiving at least 2 waiver services per month and that they are receiving waiver case management and 1 additional service moving forward. Next slide. So referrals, case managers can refer to all different types of programs and services. We issue those authorizations for those services and we coordinate all and any necessary appointments. Issuing those authorizations ensures that the individual or client is receiving the services that are specified in their plan of care, and it continues to allow them to access those needed services. Next slide. One of the activities that we do is linking families and individuals to resources, social, educational, medical. Social is a very important aspect of people's lives. And so any activities that may be in the community that would meet a goal in their plan is a priority. We want to make sure that we are addressing and identifying all of the needs that they have, not only those that are covered by the waiver, but additional broad range needs. And we want to make sure that we're achieving the plan goals and making sure that each service in the plan is being met. Next slide, please. So care planning, it really refers to the collaborative process of creating that service plan for a client based on their needs, their preferences, what their goals are. The process is really led by the waiver case manager, but we are also really interested in involving all of the other people that the client wants to be there. It's critical to making sure that it's people are receiving person-centered, goal-directed care, which really does help prevent unnecessary institutionalization, and it really supports their independence. Next slide. So key elements of care planning and waivers. We are going to assess, again, the medical, social, emotional, and functional needs of that client. We're going to work together to create goals that provide or improve the quality of life, promote independence, and maintain quality health. We're going to coordinate those services to ensure that the care plan goes as follows and ensures that services such as personal care or ABA therapy, speech therapy, etc. And all the social supports are in that plan of care. And it's going to be personalized. We want to make sure that we are being person-centered, goal-oriented, and tailored to the individual's needs. And then ultimately, the ongoing monitoring and any kind of adjustments that need to occur just continues to meet the client's evolving needs. Next slide. Anne-Marie, I think the floor is yours here.
I think we ran through this rather quickly, so let's give them some examples of the way waivers work. We talked about the fact that you have a state plan, and there's a whole list of services that are included in the state plan for South Carolina. For instance, nursing services. If I were somebody on the waiver, Margie, what other types of services might I be able to get if I were on the IDRD waiver, in addition to nursing services?
Yeah, absolutely. So, of course, nursing services are going to be provided for children under 21 under the EPSDT program, but post 21, they would have to come from some type of waiver. There could be vehicle modifications that need to occur if someone uses a wheelchair for mobility, and they may need some type of accommodation to a vehicle. There could also be adult day health cares, day activity. One of my favorites, of course, is individual employment and getting people out in the community employed with real jobs and real work. That's a really great service that is within the IDRD waiver that we can do as well. But there is a whole list, and I'm happy to provide the list to you guys so you can send those out if you would like those as well.
There's also a list of all of the waivers. They actually have a chart on DHH's website that goes through and explains the waivers, and also goes through, if you go underneath, you can go to a particular waiver like the IDRD waiver and pull up charts which show the services and give you a description of the services. You can also find the state plan on the website and all of the services that are provided in the state plan and descriptions of what those services are. An important thing to remember is that once you're a Medicaid individual, even when you're on the waiver, you may be accessing services under the state plan, and then you might also be accessing services under whatever waiver you qualify for. I kind of think of that as stacking services one on top of the other. So sometimes you get additional services on the waiver. Sometimes you're actually just entitled to more hours or units under the waiver. But usually, again, the waivers are designed for specific populations of people with very high needs. And again, it's a way to allow people to choose to receive services in the community rather than going into an institution.
Anna Maria, we have our first question if you are ready to take it.
We are.
The first question says, what does the individual employment support look like? Transportation, job coaching, and how does this differ from VR's services?
Margie, you want to take this one?
Yeah, absolutely. So, VR's goal is to locate a job for you, but it doesn't have ongoing monitorship. With individual employment, what we kind of see now is we make the referrals for vocational rehabilitation to locate the job, and then to get ongoing individual employment support to ensure that the person is satisfied with their job, make sure that the employer is satisfied with them, to provide technical support in situations where maybe both parties are not seeing eye to eye. That individual employment specialist would really work on that. But transportation, Cindy, is going to be the root of all evil in this, because there really is not a lot of public transportation to get that. So we really rely on the families to take individuals to work. But we also have additional services that are within the waivers that could kind of prepare people for employment. So career preparation. There's also group employment opportunities if somebody needs additional support or more one-on-one ongoing throughout the day. There are group employment opportunities, but individual employment does require the individual to be able to get to and from their job.
Thank you. That was a great answer. We have our next question. What are the differences between the IDRD waiver and the CS waiver? My daughter is on the waiting list for both, and we struggle to understand which would fit her needs better.
And Maria, I'll take this one if you're okay with that.
That'd be great.
Okay, all right. So the community supports waiver is a capped waiver, meaning it has a monetary cap to it. I don't have that number off the top of my head right now, but it is a capped waiver. The intellectual disability related disability kind of serves as a two-pronged waiver. And so it doesn't have a financial cap to it. And the secondary part to it is if the client meets a critical need, that client would be eligible for the residential component of the IDRD waiver. The CSW waiver does have one service that is in there. It's called in-home supports, which is a self-directed program, meaning the parent hires and fires the individual that works for them, where the IDRD does not have that. However, the CSW waiver does not have nursing, where the IDRD does have nursing, so post 21 years of age.
Great. And we have another question going, and this is great. People ask all your questions. It is great to have a discussion here. Erin says, hi, everyone. When I talk about the waiting list, I talk about not only the actual time spent on the waiting list, but the hardship in finding providers, especially in rural areas, once you're off the list. Is this something you all are seeing with your clients?
Yes, this is Anna Maria. There, and particularly with certain services, there is a very big lack of providers. So it can make it very difficult to get services. And that's why it's crucial that you really explore a lot of the services that you might be able to get once you're on the waiver beforehand. As soon as you get a case manager, then begin talking with that case manager about those providers and the service needs, and try to get things established as quickly as possible. Margie, would you have some suggestions for them?
I actually do. So I want to remind folks that there are services that are within the waiver that are self-directed, meaning you can, if you have somebody that you attend church or an aide in a classroom that wants to provide additional hours after, the families can get them hired on to provide those services that have been assessed for. So personal care can be hired on through an agency. Adult attendant could be hired on being a self-directed service. So just remember, you don't always have to use the people that are there. You can have people post 18 years of age that you know that want to provide support to your loved one be hired on by an agency.
And I think that's another, good reason why I talk about looking at the waivers that you're trying to get on. Do a lot of research into those waivers. There's a lot of information on the HHS website. There's also information on DDSN's website. You can also talk to families, case managers, like I said, and other people, including DRSC, about the services, what they mean. That they actually have specific definitions which describe them. And so it's really good to explore some of these areas beforehand. And then once you're on a waiver, please make sure that you look at those things. The definitions can change. They sometimes will change, not always eliminating a service, but they may add new services on there. Or again, they can change the amount of hours on the CSW waiver, or do something to it. The waivers are amended typically about every 5 years, but if DDSN and HHS see a need to go in and change a waiver beforehand, they have to propose that in writing to the Centers for Medicare and Medicaid Services, but they can do that. So it's always important to take time at least once a year, if not more, to re-educate yourself on the waiver that you're using and stay current and be ready to ask questions of people.
Great, thank you both. Our next question is, what is the residential component of the IDRD waiver? Does a person have to live in a facility, or can funds be used to help them live in the community?
I can take that one on. So there are So there are two components of residential. You know, you have the option and the freedom of choice to live in an institutional setting. That is part of the freedom of choice process when you're enrolling in a waiver. But there are community intermediate care facilities. There are community residential care facilities, or we call them CRCFs. There are CTH2s, which are kind of like a 4-bed group home model. There are CTH1s where there are individuals in our state that have host homes. They can have 2 individuals with disabilities living with them. And then there's also the supported living program too, which really provides support, but it's living more independently. And the least restrictive of residential services would be SLP1. And that SLP1 service would be a residential provider checking on them, say less than 10 hours a week. But they, you know, the biggest component of that is being able to afford to live in an SLP1 today just because of the cost of living.
This is Anna Marie. It's important to remember that Medicaid does not actually pay for your bed. That comes from your money. If you're a Social Security recipient, SSI, SSDI, you pay for room and board. Medicaid pays for services that you may need. So if you need nursing services or you need a personal care aide to help you get in and out of bed and to bathe and things like that, Medicaid would pay for those services, but they won't actually pay for your bed and your food and some of your other items. And again, waivers were created to provide a choice between institutional living and getting services there and getting services in a community setting. Community residential care homes are specifically defined settings. They're usually considered institutions. They have a lower level of care than a nursing home or an intermediate care facility. So you may not be able to get any waiver services while you're in a CRCF. So you have to be very careful about where you're choosing to live if you want to access waiver services. And the federal regulations that govern Medicaid were amended a few years ago to make sure that HCBS money was being spent in community settings rather than in institutions. So you always want to make sure, again, that you know, are you choosing to be in an institution? Are you going to try to access waiver services and live in a community setting? And then you have to look at, again, the level of care. We talked about the fact that all of the waivers have a fairly high level of care. So a lot of them are designed for people that might otherwise have to go into a nursing facility or an intermediate care facility for people with intellectual disabilities.
And I just want to add one little piece of that. Sorry about that. I just want to add one piece. There is a criteria that has to be met in order to be eligible for the residential component.
And can you specify what that is?
Yeah, so the South Carolina Department of Disabilities and Special Needs Commission created a directive, and really part of, and I can't give you all of them, but I can tell you some of them. You have to be homeless or at risk of being homeless. You have to have been abused, neglected, and exploited by a primary caregiver. Living at home with an aging caregiver over the age of 80 with diminished capacity. You could be judicially admitted by the South Carolina Department of Disabilities and Special Needs. You could have severe behavioral disorders that require more support than what can be provided in the home through an HCBS waiver. But there's a couple other criteria that I just don't know off the top of my head.
DDSN used to call that the critical needs list. They don't usually refer it to that anymore, but that basically has to be an emergency type situation.
All right. And Cindy, if you have any additional questions on that, please feel free to type them in. I'm going to move forward to Robin's question because I think we covered a lot of information there. Does Logisticare South Carolina still cover travel reimbursement to appointments and pharmacies? If so, what is the process like?
Yeah, so I can chat on that. It's actually the Logisticare has changed their name. It does cover travel reimbursements for parents to and from any Medicaid funded appointment. And there's also transportation that can pick you up at your home and take you to those. There is, I was going to try to find it and drop it in the chat, but there is a link that you can call or you can schedule online to do a head calling for those. They basically give you a timesheet and make you put, or mileage sheet, excuse me. They give you a mileage sheet and you put the amount of miles on there and then you submit it, and there's a reimbursement process for each mile that you go through. For any, and again, it's just Medicaid supported services. So it would not be for, say, transportation to work.
Okay, great. Thank you. So we still have time for a couple more questions. And Patrice, if you want to move to the next slide, that way they just have Margie's contact information if they need it, that would be great. And you can raise your hand or put something in the chat box.
I chopped it in the chat, but for additional information on, and it's called Motive Care now, for additional information on that program, I dropped the link in there for you to read additional.
Great, thank you, Margie. And I also dropped the link to the PowerPoint in the chat earlier at the beginning of the session. So if anyone wants to be able to go back to any of it, they can click on that. I do not see any other questions, so I think we may be done for the day. I appreciate it both, Anna Maria and Margie. This has been a great session with lots of questions, and we've covered a lot of content. So thank you very much. And as I mentioned, at the end of the year, we will release our 2025 DRSCU sessions. And we hope you will join us for those. Thank you very much, everyone, for joining us today, and have a good day.